I got this. Pardon. Oh, sorry. Okay. Ow.
According to the American Safety and Health Institute, 1 out of every 8 people do not know the proper procedures for choking and CPR on an infant. Today, there are many organizations such as the American Red Cross, the American Safety and Health Institute, or ASHI, and many local fire departments who are continuously creating opportunities for people to learn these new and proper procedures for infants. An infant is anybody from the age of birth to 1 year old. Today, this is the infant in which I will be demonstrating these procedures on. Learning CPR and choking procedures is very important because it can save an infant's life. When an infant is choking, that usually means that there is an object in their throat and it's blocking their airway. When you first begin your choking procedure, you need to make sure when you pick up your baby that you cradle its head and give its head support because their neck muscles are not as developed and strong as ours are. After you pick your baby up, you need to make sure you cradle it and then put its head below its butt. After this, you will give 5 chest compressions in the middle of its chest between the 2 nipples. 1, 2, 3, 4, 5. After that, you will cradle the baby and rotate it. You are then going to give it 5 back blows. 1, 2, 3, 4, 5. After that, you will once again cradle and rotate the baby, and you'll want to bring it close to you because you're going to check inside of its mouth and see if you can find the object that it is choking on. If you do, use your pinky finger to swipe it out and get the object. You will then cradle your baby until an EMT or firefighter has come to assist you. If you did not see the object, you'll need to give it 1 rescue breath. You will make sure you cover both its nose and its mouth. And you can only use the breath that you have in your cheeks. 1. You'll continue up to 5 cycles of this. And after 5 cycles, and if you do not find the object, you will check for a pulse in its upper arm. If there is no pulse and your baby is not breathing, you need to do CPR. CPR is very important to learn because it can save a life. And according to the American Red Cross Society and ASHI, out of all the babies that are unresponsive, 99% of them is because of respiratory failure or problem. When you first begin CPR, you need to make sure that you lay your baby on a table. You will first realize that its head or chin is very close to its chest. This constricts the airway, and a baby's airway is about the size of a pencil, so it's very easy to get blocked and be constricted. To fix this, you will need to get a hard surfaced object such as a book or a rolled up paper towel or anything else. You will roll the baby away from you and place this object underneath behind their shoulder blades. This will automatically open up their airway and move their chin away from their chest. You will first lay your hand gently on their chest for about 5 to 7 seconds to feel and see if the baby's chest is rising. A baby breathes about 30 to 60 times a minute. If you do not see the chest rising, somebody needs to contact 911 immediately. After this, you'll give the baby 2 rescue breaths, making sure that you cover both the nose and the mouth again, and only using the air that you have in your cheeks. 1, 2. After this, you'll check for a brachial pulse, which is found in the upper inner arm of the baby, or right about here. If you do not feel a pulse, you'll need to do 100 chest compressions. These chest compressions will once again be in the middle of the chest between the two nipples. These chest compressions need to be about 1 inch to 1.5 inches deep and need to be given in the time span of 1 minute. So they will need to be relatively quick and fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I would continue this up until 100. I would check for the pulse again, and if I do not feel a pulse, I would give the rescue breaths again, and then do 100 compressions. I would continue this until I can physically not do it anymore, or an EMT or paramedic or somebody will take over for me. Learning CPR is very important for a baby because it will most likely save their life. Learning CPR and choking procedures is very important also. But before you begin that, you'll need to remember, when you're doing the choking procedure, cradle the baby's head and neck and give it support. You will also need to make sure to keep its head below its bottom. And when you're doing CPR, make sure you use a hard surface table and that you have something hard underneath of its shoulder blades to open up its airway. Hopefully, with this, you are not that one person out of the 8 people. You are that 7 who will go and use these procedures and possibly save that infant's life.